All right, today we're going to talk about something really important in medical imaging. We're going to explore how we can transform what can be a scary, routine medical scan into an experience of compassionate, genuinely patient-centered care. So let's just kick things off with a really big question. When you think about a successful scan, an MRI, a CT, whatever it is, what does that actually mean? Is success just about getting that perfect, crystal clear picture for the doctor? I mean, that's crucial for sure, but is that the whole story? Well, the answer really lies in a huge but simple shift in perspective. It's about seeing the person, not just the picture. That human being who's probably feeling a little anxious. Maybe they're in pain and they have no idea what's going on. That's when it becomes a truly successful experience. And this whole idea, it actually has a name: patient-centered radiography. And look, this isn't just some fancy buzzword. It's a real commitment. It's about blending that top-notch technical skill with genuine human empathy. It means making the patient's dignity, their comfort, and their understanding the absolute top priority every single step of the way. So where does this all start? Well, it all begins with building trust. And that foundation is laid right from the get-go, in those first few moments. That first impression, it is everything. And what's so amazing is how simple these actions are, but man, their impact is profound. That first minute is absolutely critical. Just introduce yourself in your role. And here's a big one. If they're sitting, you sit down. Get on their eye level. That one little thing completely changes the vibe from "I'm the expert" to "we're in this together." And then you just listen, like really listen to their story, not with one eye on the clock, you know? And this right here. This highlights one of the biggest hurdles, but it's also one of the easiest to fix: medical jargon. You look at the left side, yeah, it's technically accurate. But for a patient, that can be confusing, even a little intimidating. But then look at the right. "I'm going to inject a special dye." See? It's the exact same information, but it's delivered with empathy. It's simple, and it instantly brings that anxiety level way, way down. You see, all these principles, they all weave together. Taking the time to get a detailed history isn't just about checking a box on a form. It's about showing you actually care. And being straight with them, being honest about potential discomfort, whether it's the position they're in or the contrast injection, that builds incredible trust. It shows you respect their experience. And a respected patient is a more cooperative and relaxed patient. All right, so we've built that foundation of trust. Now what? How do we carry that feeling into the imaging suite itself? This is where our actions start to speak just as loudly, if not louder, than our words. During the actual scan, maintaining dignity is just paramount. A simple heads up like, "Okay, I'm just going to place my hand on your shoulder to help guide you," prevents the patient from being startled. Using things like sponges and pillows, that's not just a nicety. It can be the difference between a comfortable scan and an agonizing one. And here's the tea. A comfortable, supported patient is a still patient. And that leads directly to clearer images the first time. Everybody wins. And this is the result. This quote really says it all. When these small acts of care are put into practice, the entire experience is transformed. The patient doesn't just feel like a case number or another scan on the list. They feel seen, respected, and cared for as a person. But of course, one size doesn't fit all, right? Not every patient is the same. Providing truly excellent care means being ready to adapt your approach for specific needs and some pretty common fears. This here is a great little roadmap for some of those common challenges. For a claustrophobic patient, offering ear protection and clearly explaining every single step can be a total game changer. When you're giving a contrast agent, just preparing them for that warm feeling they might experience can stop them from thinking something is going wrong. And with children, it's all about gentle explanations and keeping parents involved. It can turn a really scary experience into something totally manageable. Ultimately, when you put all of these practices together, they lead to one thing: the lasting impression we leave. And while the immediate goal is always that perfect image, the true legacy of our work goes so far beyond just a technical result. I want you to let this one sink in for a moment. The incredible, multi-million-dollar machine in that room, it's just a tool. It creates the image. But it's the technologist, the human being, who creates the patient's experience. You are the one who determines whether they leave feeling anxious and dismissed or cared for and respected. And that leaves us with a final, really powerful question. Years from now, your patient isn't going to remember the model of the MRI machine or the specific software you used. What they will remember, clear as day, is how you made them feel. So the real question is, what will they remember about you?